look at this photo. This is 30-year-old Samantha who has freckles all the way down the right side of her body. No doctor has been able to explain what this is caused by. So join us in our procedure room is dermatologist Dr. Sonia Batra to see if we can solve this mystery diagnosis once and for all.
Thank you, Travis. And yes, in fact, we're here with Samantha, and you can see her freckles on that side, but on this side, I don't see any freckles. So what an interesting, unique situation.
Yes. So Samantha, this is called a speckled lentiginous nevus. So it's a very specific type of birthmark, which started when you were an embryo, and the pigment cells in your neural crest, some of them actually developed a mutation or a change. And as the cells migrated over, it actually only affects half the body. That's why there's such a sharp cutoff.
So you've come up with the diagnosis, that's the first step?
Exactly.
Now what would the treatment be?
So for this type of birthmark, sometimes people have them very small. They're called a nevus spilus. The background is almost like a freckle. It's light pigment. But these are not typical freckles. They're actually much more organized and slightly deeper in the skin, almost like a mole. And when we treat it with a laser, we actually treat it almost like a tattoo. So a typical kind of freckle we would treat with 1 to 2 treatments. This is actually, we're going to use a really amazing state-of-the-art new laser called the Pico. And the reason it's so much safer and easier to treat a larger pigmented birthmark like this is that the pulse width is so much shorter.
So tell me, Samantha, why does it bother you so much?
I think it bothers me most. Growing up was really hard, so you know, I was teased a lot growing up, and I get a lot of stares. It's uncomfortable for my children too as well. Their friends stare at me, so I think that's probably the
understandable that you can't really cover it up all that well. So why don't we get started with that treatment?
Get started. So I'm going to hand you some goggles to protect your eyes, and I'll have
if you can lean back for us.
Yes.
Good, good, good.
So, you know, with a typical freckle, it would be 1 to 2 treatments. But like I said, these are a little deeper, a little more organized. And so we typically have to treat about 6 times for these particular pigmented spots to fade. So Samantha, I'm just going to get started, and I'm going to start up here and just move on down. And so you can see I'm just tracing along, and what we're trying to do with a little very short burst of energy is not only heat these pigment cells, but we're actually using almost like a photomechanical wave to break them up so that her immune system can go in and clear that pigment out. And this tends to be a much faster way.
How's that feel, Samantha?
Feels okay.
This is going to involve multiple sessions, and guess what? We know that you come from Palm Springs. We're setting you up with a board-certified dermatologist in your area. Dr. Kenneth Jesser is going to complete this series of Pico Cynosure laser treatments for you. How's that sound? And one more question for you, Dr. Batra. I mean, how good will this get ultimately after all the final treatments?
So actually, as you continue each time you do a treatment, it's going to get lighter and lighter. It should just gradually fade the same way when we laser a tattoo or when we laser freckles typically.
Wow.
So it should do really well.
So exciting.
All right, Travis, back to you.
Well, Samantha, best of luck. Dr. Batra, really appreciate it. What an interesting diagnosis. More to come.
Coming up next, cold and flu.